Representative Carmichael, your hand is still up. Did you have an additional question, or is that just a holdover? He's waving us off, I believe. Okay. Thank you, Nick. Appreciate that. We'll now open up testimony. We'll start with proponent testimony. We have in person Mr. Jeff Green, Senior Director of Environmental Compliance at Evergy. I assume he's going to be able to answer some of these questions that the committee has propounded to you, Mr. Myers.
Good morning, Mr. Chairman. As you mentioned, my name is Jeff Green. I'm with Evergy. I'm the Senior Director of Environmental Compliance, and I'm also representing not only Evergy, but the Kansas City Board of Public Utilities and Sunflower Electric Power Corporation. Before I get into my testimony, would you like me to address the questions that were answered first?
Yeah, that would be great.
First off, on the amendments, we did bring those up ourselves because we recognized some adjustments that needed to be made. As far as the permitting fees between federal and state, what we're proposing is KDHE is going to request permission to get a state permitting program approved from EPA. If that gets approved, then KDHE will have the program and they will have permitting fees. If it's not approved, then there will be a federal permitting program that goes into place. We don't know yet if there will be fees associated with that. If that happens, one of the amendments kicks the fee structure back down to the minimum so that we don't pay the higher fees if there's a federal program. And I don't recall what the first question was. I apologize.
Representative Carmichael, did that answer your question? I'm sorry, I can't see the way that...
Sufficiently for now. I might explore it later on, but I think we're okay. Thanks.
Okay. Representative Turner, you as well? Are you? Okay. Great. Please proceed with your testimony, Mr. Green. Thank you.
Thank you. So as mentioned, we're here about the coal combustion residuals federal regulation. This went into effect by EPA in 2015. This was the first federal level regulation of coal ash. Prior to that, KDHE has had oversight and continues to do so as far as our landfills and our surface impoundments, which are what we call ponds. They're very familiar with our facilities, and Senate Bill 417 would basically allow for a state-managed CCR permitting program so that they could continue to have oversight over our sites as opposed to that transferring over to the federal government. So the CCR rule itself is self-implementing. What that means is that we rely on qualified professional engineers to certify that we're in compliance with the regulation. And that's exactly how the regulation was written, is for us to do it that way. In 2016, the Water Infrastructure Improvements for the Nation Act, or the WIN Act, gave states the ability to apply for the state-run CCR permitting program. And at that time, it also gave EPA enforcement authority over the rule. Up until then, they only had it was only enforced through citizen lawsuits. So in 2017 and 18, our industry worked with KDHE to develop a state permitting program. We put it on hold because there were some issues with states as they were going through the approval process, some legal challenges, at least with Oklahoma. And then also there was some changes with the regulation. The rule was finalized in 15, but it's been modified a few times since then. So they wanted to let the dust settle, so to speak, before we re-engaged. So we started discussions again last year, about a year ago, with KDHE, and now we're to the point where during those discussions, KDHE brought it to our attention that in order to manage a state CCR permitting program, they need about 1.5 full-time equivalents to do that, employees. And so when you look at the number of CCR units in our state, which is about 16, them being capped at 4,000 a unit, which is what they've been charging us for renewals, doesn't give them the money necessary to staff an additional 1.5 people. So doing the math, 12,000 gives the roughly 160,000 that they need to cover those costs. So Senate Bill 417 raises that permit fee to the 12,000 minimum up to a 16,000 maximum annual renewal, which our utilities are in support of, and obviously that price will be assessed upon us. CCR rule itself is technical by nature. It requires groundwater monitoring along with various constituents, along with being prescriptive regarding what reporting we have to submit, items we have to place on our public website. A lot of these requirements can go on for decades as well. So regardless of whether or not the power plant is operating, if we have a landfill, for example, that we close in place, we're going to have requirements for a minimum of 30 years per the state regulations. Federal rule doesn't change that piece of it. If we close the unit by removing all of the ash and basically returning it to a natural state, then as long as there's no groundwater contamination, then we're essentially done within a couple of months after closure. The other thing I'll mention about EPA, they're starting to roll out more determinations regarding the federal rule. So this is 7 years after the rule was finalized. They're just now making interpretations, in hindsight, basically second guessing the way compliance has been done at several facilities across the U.S. And in fact, in January, they released these determinations, which were several hundred pages in length and applies to the entire industry. The new EPA administrator that was put in place last year has made it very clear that they're going to take a much firmer stance on CCR regulation across the board. And so this is just another reason why we would prefer to maintain, our local regulators having oversight over this regulation. As I mentioned, KDHE staff's very familiar with our sites. They approve our construction drawings, our groundwater monitoring networks, the results of our groundwater monitoring, closure plans, post-closure upkeep. And this best positions them to manage the state CCR permitting program as opposed to relying on EPA, who is not as familiar with our sites or the physical environment where they're located. So in summary, Evergy, Kansas City Board of Public Utilities, and Sunflower Electric Power Corporation are all in support of Senate Bill 417 and the associated funding we would absorb to allow KDHE to manage a state-run CCR permitting program in lieu of federal oversight by these regulators that aren't as familiar with our units. Committee, I appreciate the opportunity to come before you today and appreciate your consideration of Senate Bill 417, and I'll stand for any other questions.
Thank you. Representative Carmichael.
Thank you, Mr. Chairman. Did I understand you to say there were 16 sites involved presently?
16 CCR units, yes. So we could have multiple CCR units at one site. So a unit would be like one landfill or one pond, for example.
And is that 16 statewide or 16 that Evergy utilized?
Statewide. Evergy has 14 of those 16.
And so you're looking at about an extra $140,000 in fees, roughly?
That's right.
And then, Mr. Chairman, to wrap this up, with your permission, of course, that $140,000 goes into the rate base eventually?
That's right.
Now, I'm of the opinion, Mr. Chairman, that probably that is an expenditure that I could justify paying on my electric bill. Thank you.
Thank you. Further questions? Thank you, Mr. Green. Appreciate your testimony this morning. Are there any other proponents for Senate Bill 417 this morning? See none in the room. Are there any virtually? All right, seeing no other proponents, we'll move to opponent testimony. I have none that have registered. Do we have anyone who wishes to appear as an opponent on this bill? See no hands online. We'll move to neutral testimony. We have virtually Julie Coleman, Director of Waste Management with KDHE. Ms. Coleman, are you with us this morning?
I am. Can you all see and hear me?
We can now, yes. Please proceed with your testimony.
Very good. Good morning, Chairman Finch and members of the committee, and thank you for allowing me to join you virtually on this snowy morning. My name is Julie Coleman. I'm the Director of the Bureau of Waste Management for the Kansas Department of Health and Environment, and I'm here on behalf of KDHE to submit neutral testimony. Your staff and Mr. Green have given you a very good overview, so I will keep this brief. As you've already been told, Senate Bill 417 would revise current statute, KSA 653407, to allow us to increase the current limit on solid waste permit fees. The statute currently limits fees to a maximum of $4,000. And what we're proposing to do is to increase the permit fee limit only for the CCR units. So none of the other about 350 or so permitted solid waste facilities across the state would be impacted by this increase, just the CCR units. As Mr. Green told you, the EPA has promulgated a set of federal rules for the design, operation, long-term management of CCR units. There are additional sets of federal rules under review, So we anticipate several more federal rule promulgations. Mr. Green referred to some litigation, ongoing litigation. So that's caused this series of rulemakings that we're dealing with. But the electric power industry came to KDHE and requested that we apply to EPA for their approval to administer this program on their behalf. We've been working on that application. We're willing to take it on, but we recognize that we just can't take on the workload because it's a highly complex set of rules without the additional staffing that's being proposed. We're proposing to fill 1.5 positions to manage the program if we can get this fee increase. If we don't get the fee increase, we likely won't be able to pursue this application for program approval any further, and we would allow the EPA to develop and administer their permitting program for these units. So that's, I'll conclude my testimony there, and I'm happy to stand for any questions you might have.
Any questions for this conferee? Representative Keither.
Thank you. Do you have any, thank you for your testimony this morning. Do you have any idea what kind of time we're talking about to get approval?
Well, there's a process we have to go through. One of the requirements for the federal application for approval is that we have to have already adopted at the state level the federal rules. So over the last year or so, staff from the Bureau of Waste Management have been working on a state reg packet. We've been coordinating with EPA and trying to make sure that they're on board with us so that when we would submit our state rules, we would know that EPA wouldn't have any reservations about it. We're proposing basically just to adopt the federal rules by reference with a few tweaks just to, reflect some of the state terminology that we use in state regs.
Okay.
Does that answer your question?
It does. Thank you.
Thank you.
Other questions for this conferee? Members of the committee? Ms. Coleman, a question from me. Why is the department testifying neutral on the bill? It seems as though you're actually in favor of the bill. It basically would be your load to carry. Does the agency want this responsibility?
I think that the reason we submitted this neutral, number one, is because the industry is leading the way on the bill, and we wanted it to be clear that it's the industry coming to us, asking us to pursue this program, and we want to be supportive, and we have a good working relationship with them. But we wanted them to take the lead on the bill. And yes, we're willing to take it on, but we're just constrained by our resources. We operate on an exclusively fee funding. We manage our expenses very carefully to keep our expenses in line with our revenue, and there's a thin line between our expenses and revenue. So we just wanted to be sure that we had the resources to really take this on without impacting our ability to manage all of our other core programs that serve all of our other permitted facilities.
Great. Thank you, Ms. Coleman. Seeing no further questions, appreciate your testimony this morning. Would direct the committee's attention to written only neutral testimony from David Nickel, Consumer Counsel with the Citizens Utilities Ratepayers Board. Are there any additional questions from any member of the committee? Representative Turner, did you have a question for one of the conferees?
Thank you, Mr. Chair. Yeah, I do have a question for Mr. Green. Thank you. Having heard the other conferees, I guess I'm still a little puzzled, so maybe you can help me from the outset. So as I understand these containment facilities, there's a liner and then the facility is filled and it needs to be monitored. But I guess I'm puzzled because in your testimony, you point out that you know, the federal EPA has issued rules and that some states have submitted and received this path that we're going down. But it seems that it's a more expensive path than the current. It's going to cause them to staff up, as we just heard. So why is this it's unusual that a business is reaching out for more regulation at higher cost. I'm puzzled by that. Could you help? Thank you.
Sure. Again, Jeff Green from Evergy. It's two things really in our mind. One is if there's a proposed federal regulation out right now that establishes the federal permitting program. And then when that goes final, if a state doesn't have an approved plan, then we will be subject to the federal permitting. And like I said before, we don't know if there'll be fees associated with that or not. But the issue is we'll have dual permits at that point. We'll have a federal permit and a state permit that we'll have to, comply with at the same time for each of these units. The other piece is, as I was mentioning in the testimony regarding local oversight with these units, the state regulation that Ms. Coleman was referring to as far as adopting the federal regulation by reference, that's all true. The issue is that the regulation definitely is not all black and white. There is certainly some subjectivity in it when they're making determinations on what level of compliance or things that we have to do at each site to comply. And so our opinion is that relationships with our local regulators who fully understand our site we would collaboratively work with them to make the determinations that most reasonable or least cost possible while still complying with the regulation. We feel like EPA or any regulator that's not local is going to likely pick the more conservative approach that would likely be more expensive in the long run. So in our opinion, while this does raise permitting fees and does cause an increase of about $140,000 a year, we feel like that's going to be far less than the other outcome, which could be much higher cost to comply with the federal regulator.
Can I follow up? So these other states, you say some states have submitted and are going this path. Are others choosing just to take whatever lumps the federal gives them?
That's right. It's a mixed bag. We know there's at least 3 states that have approved plans right now. Based on Evergy having some service territory in Missouri, we're having discussions on that side of the line to move the same direction. But I can't speak for the other states, honestly, why they do or do not pursue a state permitting program.
Thank you. Thank you, Mr. Chairman.
Committee, any other questions? The second bite at the apple. Mr. Green is thrilled.
Yeah. Mr. Chairman.
Representative Keither?
Thank you, Mr. Chairman. Mr. Green, can you tell us which states are adopting the program?
Yes, it's Oklahoma, Texas, and Georgia have approved plans right now. And I'm not familiar with which ones are in the process of, what we're doing currently in Kansas.
Okay, but you're going to be promoting it in Missouri, possibly?
Evergy is, yes, that's right.
Okay. Thank you very much. Thank you, Mr. Chairman.
Seeing no further hands, I think you're off the hook today, Mr. Green. Thank you for being here and for your testimony. Also to Ms. Coleman and Mr. Nickel. With that, we'll close the public hearing on Senate Bill 417. Committee, we can expect to work this bill on Tuesday. Next, we'll open up the hearing on Senate Bill 19. I would ask the reviser for a quick presentation.
Committee, Senate Bill 19 is a transportation bill, and what it does is it designates would designate a certain portion of certain highways and name those portions of the highways. I will note that the contents of this bill were inserted into House Bill 2247 last year by the Senate Committee on Transportation, and then House Bill 2247 was enacted into law on July 1 of 2021. So the contents of this bill are enacted into law. And Mr. Chair, unless you want me to get into what those contents are, I'd be happy to answer any questions.
Transportation bill is mostly here to be a vehicle. So are there any questions for the reviser's office? Thank you. Seeing none. Are there any proponents who wish to testify in favor of this bill today? Seeing none. Are there any opponents who wish to testify on this bill today? Seeing none. Are there any neutral conferees that wish to testify on this bill today? Seeing none, we will close the public hearing on Senate Bill 19. You can expect that we will take it up on Tuesday. That moves us to our final order of business today, public hearing on House Bill 2281. And we will open that hearing and ask for an overview from Nick Myers.
Thank you, Mr. Chairman. Committee, House Bill 2281 is the 988 fees bill. This would provide for the establishment and the implementation of the National Suicide Prevention and Mental Health Crisis Hotline that's designated and has a 3-digit dialing code of 988. That's going to be effective July 16 of 2022. So just kind of some background, some recent federal legislation, including the Federal National Suicide Hotline Act from 2020, and recent actions by the Federal Communication Commission have established 988 as that dialing code at the federal and state level. And these federal efforts were intended to create an easy to remember dialing code and to strengthen local crisis response system capacity. And again, as I said, beginning July 16, 2022, all telecommunications providers must route their calls and texts made to 988 to the National Suicide Prevention Hotline. And committee, this bill establishes the structure for the state's implementation and administration of this federal 988 initiative. So what the bill does is it states that the Kansas Department for Aging and Disability Services would be required to do certain things prior to July 16, 2022 in preparation for this initiative. And you can see in my memo what KDADs would be required to do, designating hotline centers to provide those crisis intervention services and care coordination, creating a system to ensure communication, coordination, and deployment of real-time crisis care, convening of mobile crisis teams, developing guidelines for deploying and coordinating services, referrals, and follow-ups, coordination of consistent public messaging, requiring training for hotline center staff, developing plans for payment for CanCare members and uninsured services, creating an advisory board for guidance and recommendations, hiring a statewide suicide prevention coordinator, and then also adopting rules and regulations to implement the law. As I said, telecommunications providers would be required to appropriately route their calls using that are dialing that 988 code, and the state's hotline centers would be required to comply with the requirements in the bill relating to participation and receipt of the calls, the staff training, coordination of crisis response, and follow-up services, and then also call routing for veteran services. Sections 5 and 6 of the bill impose fees upon certain telecommunications services. So Section 5 of the bill would impose a monthly 988 fee in the amount of 20 cents on each billed service user of any exchange telecommunications service, wireless service, voice over internet protocol service, or other voice service capable of contacting a hotline center. This fee would be required to be conspicuously stated as a 988 fee on each bill, and providers would be required to collect and remit those fees to the state treasurer for deposit into the 988 Suicide Prevention and Mental Health Crisis Fund, which is established in this bill. Section 6 of the bill would impose a prepaid wireless fee in the amount of 0.4% per retail transaction for prepaid wireless services. So these retail sellers of prepaid wireless services would be required to collect those fees and remit those fees to the Department of Revenue pursuant to payment procedures established by the Department of Revenue. The Department of Revenue would then remit all those fees to the state treasurer for deposit into that 988 fund. So Section 7 of the bill establishes this 988 Suicide Prevention and Mental Health Crisis Hotline Fund. And in addition to those 988 fees that it is collecting and providers and retailers are collecting, the fund would, or the bill, I should say, would provide for a demand transfer of $3 million from the state general fund to that 988 fund established in the bill. This fund would be administered by the Secretary of KDADS, and the monies in such fund could only be used for essentially the purposes of the bill. So it's ensuring efficient and effective call routing and personnel, provision of acute mental health, crisis outreach, and stabilization services, public promotion, and data collection and reporting. Section 8 of the bill would require the Secretary of KDAS to submit annual reports to certain House and Senate committees detailing outcomes relating to the implementation of the 988 hotline, along with key performance indicators. Section 9 is a short little section that would encourage each school district that use student identification cards for students in grades 6 through 12 to include the 988 number on those cards. Section 10 would establish the 988 Coordinating Council to monitor the delivery of services, develop strategies for future enhancements, and to distribute available grant funds to organizations that provide associated services. The 988 Council would be composed of 15 voting members, generally with the members appointed by the governor, except for 2 members that are appointed by the LCC, with one from the House Committee on Appropriations and one from the Senate Committee on Ways and Means. And committee, I would direct your attention to either my memo or the bill if you would like to see the membership, and I can go into those individually if you would like. The 988 Coordinating Council would also include certain non-voting members that are appointed by the governor. And you can see those non-voting members, generally members representing telecom industry, municipalities, and some other certain interests on the non-voting member side. Members appointed by the governor would serve a 3-year term and could not serve more than 2 terms. And the governor would be selecting the chairperson of the council. And the bill would also require or allow for the council to adopt rules and regulations to implement the provisions of the bill. Generally, council expenses would be paid from the 988 Suicide Prevention and Mental Health Crisis Hotline Fund, with not more than 2% of the fees that are collected from providers to be used for the expenses of the council. The council would also have the authority to ensure that annual reports are submitted by Lifeline centers regarding how the monies are expended by those centers. And there's a little stick here. If a Lifeline center fails to file such report or violates any other provisions of the bill, the council would be authorized to withhold 10% of any subsequent distribution of 988 fees. The council would also have authority to impose a civil penalty upon a telecommunications provider in an amount not to exceed $10,000 should any such provider violate the provisions of the act. Finally, the bill would also require the 988 Council to provide an annual report that provides a detailed description of all the expenditures made from those 988 fees. And this report would go to this committee and the Senate Utilities Committee. Mr. Chair, I'd be happy to stand for questions.
Representative Carmichael.
Thank you, Mr. Chairman. Mr. Myers, as I understand it, the federal legislation authorizes the imposition of this fee, but still yet allows states to fund these services through other means if they choose. Is that correct?
That is correct, Representative. That Federal National Suicide Hotline Act does authorize state imposition of fees, but it doesn't set any specific requirements or impose any fees upon or require states to implement any certain fees.
Mr. Chair, with your permission, a second question.
Yes.
The federal legislation, as I understand it, authorizes the fee to go not only for the technical costs, the switching costs, et cetera, of routing the calls, but also permissively allows the fee to go toward the provision of the actual services, but again, does not require that. Is that correct?
I believe so, and I will pull up that federal act and look again, but I believe you are correct.
You only need to let me know if that's incorrect. Thank you, Mr. Chair.
Certainly.
Other questions for the revisor? Representative Gartner.
Thank you, Mr. Chairman. Nick, what is do we have a fiscal note on, you've already mentioned the 3 million from SGF, 20 cents on exchange wireless, 0.4% on prepaid. Do we have a overall fiscal note of cost or revenue that we're looking at?
Representative Gardner, I don't think you have it there remotely, but we do have a fiscal note in the file here. It indicates in fiscal year 2022 an expenditure of $2,029,110 and out of SGF, and a similar expenditure out of all funds and one FTE position.
Okay, thank you, Mr. Chairman.
Other questions?
Yes, Mr. Chairman.
I'm sorry, I didn't hear who that was. Representative
It's
Carmichael.
Carmichael. I put my hand back up again, Mr. Chairman. An additional follow-up, please.
Yes, proceed.
Thank you. Whether it's from Mr. Myers or perhaps we know from a fiscal note that I frankly haven't had a chance to see, do we know what the total amount of revenue to this 911 council is anticipated to be if we include the SGF contribution, but also the 20 cent per line or 0.04 cent per phone fee? Do we know how much revenue is coming into this proposed 988 council?
Representative Carmichael, in the last paragraph of the fiscal note, says the Kansas 911 coordinating estimates that there are 2.9 million subscriber accounts that would generate 17.4 million per year if it were a 50-cent fee.
So we could cut that by 2/5 if we were at a 20-cent fee. That'd be, is my math right? You have the numbers in front of you. I don't.
Yeah, it'd be 40% of the
Yes.
17 million, which roughly 8.5, probably 7 million.
Thank you for your assistance.
The only math I do is figuring out a third my fee. But any other questions for this for our revisor? Okay, seeing none. Nick, I think you're off the hook. We'll start out with proponents. I have in-person proponents, Jason Watkins from the Wichita Regional Chamber of Commerce. Mr. Watkins here this morning. Mr. Watkins online this morning. Okay. We'll convert him to a written only proponent. His testimony is in your file. I commend it to your reading. Next up, we have Nick Wood, the Associate Director of Interhab. Mr. Wood, welcome to the committee.
Thank you, Mr. Chair. Members of the committee, I'm signed up as a proponent. Interhab has put a lot of resources actually into advocating for the 988 bill. But we may, in fairness, be more neutral or even opposed. So I don't know if you want to hear my testimony now or after proponents.
You're here. We'll hear it. We'll slot it where we need to.
Okay. And I want to be respectful. I know that the committee just planned to talk about the fee today. But in the last hearing in House Health, there were, of course, a lot of changes made to the language for the substitute language. And they addressed, I think, what it's section 5 of the previous bill that had the fee fund in there. It also had services language in there, which is what was significantly changed. So we would support the bill if we could work with members of the committee on an amendment to fix some of that language. And for the most part, we are looking at language that was in section 5. We think it could be moved to new section 3. But would like to work with the revisor to see how it could be best worded and where it would be best placed.
What would your amendment do? I'm sorry.
It would provide mobile crisis response services for persons with intellectual and developmental disabilities, and then the same phrase, provide mobile crisis response services for behavioral health needs.
as I understand the system, individual in crisis calls 988, indicates they're in crisis, and services are made available to them one way or another, either a community mental health center or CBHC is contacted and they're placed in touch with each other. Is it your belief that someone who was a member of the IDD community would not be treated the same as any other caller to the 988 line?
Well, there's sort of there's a historic problem in Kansas when it comes to crisis services for people with IDD, and then potentially a problem with this implementation. So in Kansas, we don't actually have good statutes that address the mental health needs for people with IDD. Certainly not crisis services. It's not in statute. It's not in reg. We don't even really have policies. We don't have services or specific funding. So we actually, Interhab has a bill that is technically on the House floor. It's House Bill 2373, which is meant to address that problem. If 988 bill passes, then that will be the language that we will be in statute and that will affect us and our services. So yes, we do expect that if people with IDD call the hotline, which they will, that it would get referred to someone in our system. That being said, there are probably between 30 and 40,000 people in Kansas with IDD. We only serve about 9,100 on the waiver. Most of those other folks do have Medicaid, but they're not really known to the system. So we potentially would be getting referrals with people with IDD, people with autism and that sort of thing, that are unknown to the system. We also, again, just don't have the specific services. The whole IDD system is really built around what's called personal care, and is not a crisis response service. So,
Did you have more testimony, or are you ready to stand for questions, Mr. Wood?
I'm ready to stand for questions.
Okay. Any other questions for this conferee? Representative Turner.
Thank you, Mr. Chair. So I guess I'd summarize quickly for me the answer to his question. I wasn't clear that I heard it. So you feel that the existing response mechanisms that were in the bill aren't sufficient to serve the IDD folks. Is that correct? And that's why you're asking possibly for an amendment.
Correct. Yes.
And in what way are they not being responsive? Are the folks don't understand this unique needs of this set of folks versus other illnesses, mental illnesses or whatever? I don't want to put words in your mouth. I'm trying to understand the
You're
nature
exactly
of
right.
the concern.
And we have been talking about it in other committees, but yeah, there's sort of an age-old problem that when someone with IDD lands in a hospital emergency room and is evaluated, or comes to a crisis center at a mental health center, that very often that clinician doesn't feel like they are able to sort of assess and provide follow-up services for that person. So there's a desire then to be able to refer to someone who feels more confident working with people with IDD. And that's often where the problem comes in. How is that referral made? How is the coordination or the collaboration between the systems happening? We just don't have, again, good laws, policies, services to do that. There's lots of stories of people being referred, and then those are the folks that fall through gaps and barriers in our system.
Can I have a follow-up, please? Yeah, I mean, some of the original testimony I know was that now the predominant mechanism of response is police, and police don't understand somebody that's acting criminally versus somebody that has mental issues. And so these response vehicles would have people that would be qualified to sift one of those situations from another. And that's why I'm puzzled that within that second group of now talented people that understand behavioral issues, you feel that there's another segment that's not being represented in that. And I don't want to, again, put words in your mouth, but I think that's what I'm hearing. Is that fair?
It becomes, I think, too complicated at that moment when you are trying to help somebody who's in a crisis situation. For first responders or even clinicians to make a decision on the spot. So it's good for states to have a model and have model policies and training and coordination amongst professionals who can monitor our crisis services statewide and help to ensure that that collaboration is going on. Yeah.
Thank you. Thank you, Mr. Chair.
Representative Mason,
Good morning, Mr. Chairman. Can you hear me?
we can.
Thank you. Question for the conferee. It was my understanding that in the original drafting of the bill, the language to service the IDD community was in there. And then when it became a sub-bill, it was omitted. Is that correct?
Yes, sir.
And do you have an inkling why that why that happened? Was it just an oversight or what?
Well, so thank you. It's a good question. And I have questions about the process myself. There was a hearing in House Health. They discussed some amendments. A lot of the language that's in the substitute bill was written after the hearing, from my understanding. It looks like it was published or at least read in on February 26th, which was right before turnaround. I really wasn't able to get clarification on the language until very recently. So I'm not sure that the language that's in the substitute bill was even has been heard by any committee.
Well, I would say, Mr. Chairman, that if there's any ambiguity at all on this, it does need to be clarified that the IDD community would be involved. So thank you very much. Appreciate your time.
Representative Keither.
Thank you, Mr. Chairman. And follow up on that, I think, Nick, it would be helpful if we could see that language that that was in the original bill that you prefer. But my other thought is this something, there's a lot of training reference in this legislation and rules and regs, and you don't think something like that can be addressed through that mechanism?
I don't without a good statute. The statute language, or that what would be in statute from this bill, I don't want to characterize it as weak, but as someone who reviews and helps write policy a lot, it would be difficult to write the right policy based on that language.
Well, then get the good language to it and let's take a look at it. Thank you, Mr. Chair.
Further questions for this conferee? Seeing none. Thank you, sir. Appreciate your time and testimony this morning. Next up, we have Monica Kurz, Vice President for External Programming with Kansas Suicide Prevention Headquarters.
Yes, thank you, Mr. Chairman. I am online.
Okay.
Thank you for the opportunity to speak to the committee today regarding the fee to support 988. I am with the Kansas Suicide Prevention HQ. We are one of 3 crisis call centers serving the state of Kansas, currently on the National Suicide Prevention Lifeline, and in a matter of months on 988. My center provides services to people in all 105 counties. We're the only crisis call center to do so in 103 of those counties. We are joined by Johnson County Mental Health Center and ComCare of Sedgwick County to serve the people of Johnson County and Wichita. As the committee is aware, we have a big job ahead of us as we transition to 988, an easy to remember 3-digit mental health crisis and suicide prevention lifeline. We know that it has been incredibly important for us to be prepared to answer every call that comes in. With monies that were allocated last fiscal year by the state, the system has been able to make significant gains in a system that previously did not have adequate capacity to serve the people of Kansas who were experiencing a crisis. You'll see in my testimony that I reference a 26% increase in the number of calls that originate in Kansas on the National Suicide Prevention Lifeline that are answered by Kansans. We think that this is important because the more of those calls that we keep in state, the more people we are able to direct to local resources and adequate follow-up services. Previous to those monies being allocated, almost 40% of National Suicide Prevention Lifeline calls were being routed out of state simply because there were not people to answer those phone calls. Our current key performance metrics indicate that we are answering the majority of calls in Kansas within 15 seconds of those phones ringing. I think that it's incredibly important that we fund a system that's able to continue that level of service. I can share with the committee that I recently had a conversation with a behavioral health services provider who was serving someone in Missouri. Her client stayed on hold for 2 minutes calling a Missouri crisis line, and she hung up. She didn't have the resources, the internal resources to wait that long. So when I say that I truly believe it's life and death, that we have sufficient capacity on this line, I don't think that I'm exaggerating. We've been able to make the gains that we said, because of those technological advances, but also because of our ability to hire staff and to keep our staff highly trained. I think it's important for the committee to understand that no one graduates from a program ready to answer calls on a suicide prevention or mental health hotline. We do about 100 hours of internal training that includes live sessions, independent reading, observation of live phone calls, and a lot of role play practice. We know that we need to get folks prepared to answer just about any call that may come in. And believe me when I say we have a lot of unique calls that do come in. I mentioned this because I think it's important for the committee to understand the critical nature of a sustainable and reliable funding source such as this phone fee. This is not a service that I can turn off and on like a faucet. I already deal with pretty high turnover due to the really intense nature of the work that we're asking folks to do, and need to operate a continuous training model to ensure sufficient staffing levels. If we were to experience a downturn in budget and had to let folks go, I know that we would not be able to return to sufficient capacity in a timely manner. And I'd like the committee to consider that as you really look at this fee. I also want to address any questions that the committee may have about how 988 and 911 interact. I really see these two numbers as two sides of the same coin. We have the ability here to serve folks in a more enhanced and detailed way when it comes to their mental health crisis, while also reducing the burden of those primary mental health calls on our law enforcement partners and our 911 telecommunications partners. We have some reports from the Substance Abuse and Mental Health Services Administration, as well as Vibrant Emotional Health, who administers the National Suicide Prevention Lifeline, that estimate that about 8% of all 911 calls are a primary mental health concern. Based on their estimates, we think that in the first few years of service, between 10 and 30% of those folks will self-divert from 911 to 988 as they become educated about the hotline and what we're able to do, which is to truly provide an intervention on the phone without waiting for folks to respond in person. We need that capability, but we know that the vast majority of the time we don't need to use it. We also know from people who are piloting programs of transferring current phone calls from 911 to mental health hotlines that this can be a successful model, which decreases the amount of time that 911 telecommunications professionals need to spend on a telephone call with someone that they frankly aren't equipped to help. And we have started discussions with the 911 Coordinating Council contractors about how we put together a system that looks a lot like these other models, but will be more specific in Kansas. And I'm optimistic about the progress that we'll be able to make together. So in closing, I just want to emphasize that we have estimates that this program will cost about $6 million in Kansas, and that needs to be, in my opinion, very reliable funding so that we are able to answer every call every time in a timely fashion, and look forward to working with the legislators on identifying what that reliable and sustainable funding stream will look like. And I'm very happy to stand for questions at the appropriate time. Thank you.
Thank you. Questions for this conferee? Ms. Kurz, what is the current source of your funding?
The current source of our funding, so we our center is a little bit different than the other two centers because we are not a community mental health center. So we operate based on a mix of private donations, so our fundraising operation, local monies that are directed to us by Douglas County, and then contracts with both the Kansas Department for Aging and Disability Services and the Kansas Department for Health and Environment. We do a number of training programs in addition to our hotline services.
Any other questions for this conferee? Seeing no hands up online, no one here in the room. Thank you for your time this morning, Ms. Kurz. Appreciate it. Next, I have Amy Campbell with Kansas Mental Health Coalition.
Good morning. Sorry that I can't be there in the room today. Can you hear me?
We can hear you.
Fantastic. So I represent the Kansas Mental Health Coalition. The coalition is a roundtable organization. We have members ranging from psychiatric hospitals to community mental health centers to advocacy organizations like NAMI and Mental Health America, and the Association of Social Workers and other professional organizations. We endorse House Bill 2281. When I was serving on the Legislative Mental Health Task Force, the members of that task force who were representing families and individuals with mental illness had a very specific recommendation regarding to a front door to our mental health system that allows people access to the services they need at the time that they need it. They spoke very clearly about where we have gaps in our system relating to how we can respond to people in crisis and in providing the appropriate sort of referrals and screening necessary in a time of crisis. So it was good timing that the federal government decided to pass the National Suicide Hotline designation of 2020, which attempts to really set up this system that would serve as a functional front door to our system. In my testimony, I have a little bit of that background for you, but I won't go over that today. This is a very important step as we modernize our behavioral health system and attempt to deal with some of the statistics in Kansas that are really going the wrong direction for us as they relate to suicide and addictions, and the number of people who end up on waiting lists for services or waiting in emergency rooms or jails. The sustainable funding source that was recommended by the federal government is this telecommunications fee. They also recommend that states look to diversified funding sources. I want to be clear that this fee does not support the entire system of response that would be set up by the 988 legislation. You would see diversified funding resources, including building on the Medicaid reimbursements, the work that you have all done related to CCBHCs, and the mobile response that those centers will be making available, and the federal block grants that come to our state for mental health and addictions treatment. So I think it's really important to realize that the 988 strategic plan does not expect that this fully funds the mental health system. What it does is specifically take care of the front door, the training and accreditation necessary to have an effective answering system, the de-escalation training, and then also the fact that we have to improve the call answer rate that Monica discussed. And I really recommend that any of you who are interested should look at the 988 strategic plan document that KDADS has put out. They've done the work that the federal government requires to lay out the strategies necessary for this system to work. Additionally, that plan includes evaluation and follow-up and oversight, which is something that I think this legislature has been looking for from the behavioral health system for a number of years, and that has been being put into effect through many of the programs that you have adopted prior to this and would certainly be a part of the 988 system. At the end of the day, it's very important that we look for a sustainable funding source. I've been working on mental health issues in the Capitol for 20 years, And we have seen the ups and downs that occur when we rely on the state general fund, but revenues change, and then we back off on things that we are already doing. Many of the mental health funding pieces that you all have approved in the last 2 years are literally restarting things that we used to do that were evidence-based practices that we knew worked at the time. So we are highly encouraging you to look for a sustainable source such as this per line fee. Wherever you decide to go, we urge you to consider the benefit of this type of a fee or another sustainable resource that would not be going up and down over time. The numbers you look at for FY22, please be aware that those will change as you deploy this resource. July 16th is the drop dead date. 988 goes live regardless of what we do. So I highly encourage you to build on all of the work that's been done by the strategic plan and the coalition that put together all of that information. And with that, Mr. Chairman, I'd be happy to stand for questions.
Thank you. Representative Carmichael.
Thank you, Mr. Chairman. Thank you for your testimony, Ms. Campbell. The DCF plan that was referred to in your testimony, does anyone know, is it in the materials for this hearing? Or if not, where could I access that? And I'm sorry that I don't have my materials this morning.
I'm happy to attach a link to it if that would be helpful. On page 2 of my testimony, I do include the core areas and priorities for your information, and I'd be happy to attach a copy of that report.
Mr. Chairman, with your permission, could I ask that legislative research at least get me a link to the report, if not the entire committee? That's your determination.
Yeah, we'll get that emailed around to everyone, whether through research or Ms. Campbell. If you want to send it to the committee assistant, we'll get the link distributed to committee members.
Okay.
Other questions for this conferee? Seeing none. Thank you, Ms. Campbell.
Thank you.
Next up, we have Pat Fusick, Director of State Government Affairs for T-Mobile. Mr. Fusick, are you with us online today?
Yes, sir, Mr. Chairman. Can you hear me?
We have you.
Okay, thank you. Good morning, Chairman Finch and members of the committee. I am Patrick Fusick, and I am the Director of Government Affairs for T-Mobile. Thank you for the opportunity to provide some brief testimony in support of House Bill 2281 on behalf of T-Mobile, which, as you've heard, establishes the 911 suicide prevention and mental health crisis hotline. I won't, read my testimony just to kind of cover some main points because I know you want to focus a lot on the fee portion of the bill. We supported the federal legislation. Our federal team worked on that when that was passed late in 2020, and it did provide, basic guidelines for the states to impose a telecommunications surcharge on end users to help fund the 988 system in any given state. And I think we've heard from other conferees that the surcharge is not designed to be the sole source of funding for the program. As you've heard, a mix of federal, state dollars, and then potentially a surcharge revenues, which we estimate. I think you mentioned the fiscal note. We've talked with ks.gov and worked closely with, over the last 2 years, worked closely with Chair Landwehr and also Andy North and ks.gov on those dollar amounts and the figures. And we estimated at that to bring in the 20-cent fee to bring in revenue wise about $7 million. As I mentioned, I've worked on this issue in multiple states, and we first time we saw it last year. We just hadn't seen this issue similar to a 911 fee where it would be imposed onto the end users' bills. We worked and they were very helpful to have language inserted that the industry was looking for regarding how it's implemented on the bill, how we collect it and remit it, similar to what we would do with 911. And with regards to, whether it should be a surcharge or not, we support the bill with the surcharge in there. We understand several states have passed bills. There's about 4 states with surcharges. There's some states that have passed a mental health bill like this 988 bill without a surcharge. And I know there's a couple of bills that I have in a couple of my states in the Midwest, Michigan and Illinois, that are pending right now this year that also do not have a surcharge. I think the reason, they're looking at using something, state revenues other than a surcharge right now is because they have those surpluses. So while those dollars are available to the states, looking at the surcharge dollars makes sense. I do agree, though, that if there is a longer term, if those funds might dry up eventually, and there's a need to have a more sustainable long-term fee, that is something that you might want to look at down the road if we choose not to have a surcharge included in this legislation now. So I just wanted to point out that we're fine either way you go. And again, we've worked with the other folks in industry and been very close working with Chair Landwehr. Appreciate all her consideration and the Health Committee's consideration of some of the amendments that were added in subcommittee. We were supportive of that and helped draft that. So that is my testimony, Mr. Chair. I'd be happy to answer any questions that anyone has.
Questions for Mr. Fusick? Seeing none online? All right. Thank you, Pat. Appreciate your time this morning.
Thank you all. Appreciate it.
Next, we have Michelle Ponce, Associate Director of the Association of Community Mental Health Centers of Kansas.
Good morning. Thank you for the opportunity to testify this morning. My name is Michelle Ponce, Associate Director of the Association of Community Mental Health Centers. We represent all of the licensed community mental health centers across the state, and we are here to testify in support of House Bill 2281. Rates of death by suicide in our state are something that we regularly track and are of great concern to our association and our members. The community mental health centers across the state are actively engaged in suicide prevention efforts and also providing crisis services. In terms of 988, we support the state identifying a long-term sustainable funding mechanism, such as the fee on cell phone bills. And we also support the creation of a 988 council that this bill would create to monitor services and recommend future enhancements as necessary. That is the short of it. I know you're short on time today, and I will be happy to answer any questions you may have.
Questions for Ms. Ponce? All right. Thank you very much for your testimony this morning.
Thank you.
Committee, we have written only proponent testimony from Roxanne Van Gundy with the Kansas chapter of National Emergency Number Association. Are there any other proponents on this bill this morning? Okay. Are there any opponents to the bill this morning? Are there any neutral conferees appearing in person? Seeing none, I would direct your attention to the 3 pieces of neutral written only testimony that we have before us. Is there anyone else to be heard on this bill this morning? Seeing none, we'll close the public hearing on House Bill 2281. Committee, that concludes our hearings this morning. I would encourage you to take a look at 2281 and 417. It would be my intention, if the committee is willing, on Tuesday to start our work on Senate Bill 417 and then to take up Senate Bill 19 as a potential vehicle for the 988 matter. We are getting late in the session, and if we're going to send that over to the Senate, I would like to do it in a Senate bill so that we might speed the process along over there. I do think the question for the committee will be whether we want to proceed with a fee at this time, surcharge, or whether we want to do something different. And so I would welcome the committee's input and thoughts on that. And I know that Chairman Landwehr has done yeoman's work on this bill in her health committee. And she has requested a couple of amendments to the bill that I will be reviewing with her and then talk with you all about on Tuesday. But if you have amendments, I encourage you to get with Nick early. It's better than late, and have those amendments ready, and then come prepared to talk about them on Tuesday. Is there anything else for the good of the order today? All right. Seeing nothing, we will be adjourned.